From the moment we are born, stories play an integral role in connecting us to the community we're a part of. Today we're taking a look at the importance of storytelling and compassion in leading teams in today's healthcare environment. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hederle, Senior Writer for AHA. In this episode, Elisa Arespacochaga, Vice President of AHA's Physician Alliance, speaks with Laura Crooks, Chief Executive Officer of Children's Village in Yakima in Washington State, and co-founder of Chad's Legacy Project, an organization dedicated to reducing stigma around mental illness and connecting people to treatment.
Welcome to another podcast in the American Hospital Association's ongoing series where we focus on important issues facing clinician leaders. I'm Elisa Arespacochaga, Vice President of AHA's Physician Alliance, and today I'm joined by Laura Crooks, Chief Executive Officer of Children's Village of Yakima in Washington State. In addition to serving as CEO, she's also the co-founder of Chad's Legacy Project, dedicated to reducing stigma around mental illness and connecting people to treatment. Today, we're talking about how to lead with compassion and humanity in today's healthcare world. To get us started, Laura, can you tell me a little bit about yourself and your work?
Yeah. So again, my name's Laura, and I am as you mentioned, CEO of Children's Village of Yakima, which is a center dedicated to pediatric specialty healthcare, both in the ambulatory and there are inpatient components to our work as well. Primarily rural health, although we do have some small urban centers here where we provide specialty care, and are the pediatric specialty care center for the entire eastern side of Washington State. I spent the last 25 years at Seattle Children's Hospital prior to coming here, so I have a lot of experience in pediatric and have a clinical background as an occupational therapist before I went into leadership. So that's a little bit about my professional life. But in terms of my personal life, there are a few things that I want to share. The first is on my personal side. And just almost 4 years ago, I lost my oldest son to suicide after he had been diagnosed with schizophrenia, and the voices had told him to go around the corner from our house and jump off the bridge, and he did that. And we know that happened because he left us a note saying that he felt like they were taking over his mind. And when that happened, that was a real turning point for me within leadership. And I obviously took time off from work because it was entirely devastating to me, and my entire world turned upside down. And when I went back to work, it was really interesting and profound to me around how we function within healthcare when we have tragedies that occur personally, both for ourselves and with our colleagues. And when I returned, one of the conversations that I had with another leader in the organization was around the fact that I had not been able to function at the same level that I had previously. And she actually had said to me she felt like I was letting things fall through the cracks and that I was too sad and people couldn't come to me. And at that time, it was not only shocking, and I just want to say this was a fellow compassionate leader, physician, phenomenal person who didn't know how to handle my grief as a colleague. And we patched all of that up shortly after. But during that time, it really led me to reflect on what are we doing in healthcare where we are functioning always and expected to always function at 100%, where there is no room for any less than that. And a place where we can have compassion for the patients and families that we serve, but we don't know how to do that with each other. That when things are happening that are hard, often out of our control, we don't know how to step into that space of being able to provide grace and support to each other like we do to our patients and families. And if we could be a place, an organization, a system where we could provide the same compassion to each other that we do to those that we serve, how might that change what healthcare looks like for the future? And so that became my work. And I shifted from really clinical operations and oversight into a more experienced leadership and really trying to lead with compassion to support people to be able to be in a space where they can support the patients and families.
Now, I know we've talked a little bit about how that changed your leadership style. How did it really change your approach?
Yeah. So it was profound to me that when I started to say what had happened to my family and what had happened to my son, and in sharing our story, others came forward to share their stories. Many have had similar situations. And with Chad experiencing mental illness and 1 in 4 people in any given year having a mental health crisis, it impacts so many people who were otherwise silent. And in being able to lean in and share our story, it meant others were able to do so as well. And that was really transformational, both for me personally, but for those around me as well, in being vulnerable as a leader to say, this happened to me and this happened to our family, and then this is what I experienced afterwards. And to not place blame on people, but to really be a part of the human experience of both delivering healthcare and receiving healthcare. And in that place of humanity, really being able to come to a place of common experiences and understanding so that then we can really look at how we might do things differently together. I think often we try to be the knowledge experts. There are many times when we have to be within healthcare, but then there are these other spaces in which there is no real right or wrong. There's no black or white to the answer. And in that is where our common humanity lies, and our compassion for each other in being in these spaces that are really hard together. And people weren't able to do that before, and I hope that they are able to do that now in the places where I'm able to have a presence or a little bit of an influence. Part of that is also around telling your story, and the stories are really, really important. And I'll give you a story besides the one with Chad that is an example of this. And in the place where I am now, we had a staff member lose her husband suddenly and was out. And I pulled the leadership team together. And in that moment, I said to them, it is going to be hard when she comes back to work. And we're going to have to expect that she's not going to be perfect and not be able to function in the way that she did before. But we can rally around her, and we can put supports in places to be able to back her up. So if something happens, we can catch her, and we can catch the mistakes before they impact the patients and families. But we can allow her to be here, and we can say to her, this is really hard, but we're here. And we can say to her, we're so glad to see you today, and not ask her how it feels, because we know how horrible she must feel. But we can be in this space, and we cannot have the perfect words, but we can rally around her. And in that conversation of really leaning into the situation, the leadership team felt really empowered in a way that they hadn't before. And one of my leaders actually said to me in walking in from the parking lot a couple weeks later that otherwise she would have maybe avoided this staff member because she would have been uncomfortable. But the ability to recognize there aren't perfect words, but to be able to just say, I'm glad to be here with you. And then to be able to do something behind the scenes empowered her as a leader to change how she thinks about those things. And those stories are really important.
That's very powerful, the ability to just come with empathy and spend time with people when there isn't anything you can do or say except be present with them. That's really powerful. So how do you encourage your whole team to bring compassion to their work and support each other in a more day-to-day activities?
Yeah, so there's a couple different ways that we do that. The very first thing is you have to lead by example. You have to go out and people have to get out of their offices, especially leaders. We have to talk about things that are hard, even when we don't have all the answers. We have to address issues that come up with transparency, but also, some discretion around the things that we're sharing to not increase anxiety or uncertainty for people when we don't need to. But when there is uncertainty and people know that there are decisions that need to be made, being able to say that, to say we don't have all the answers yet, but we're going to figure it out. And that's important for people to know, that you're not losing track of things or that there aren't conversations that they're not a part of or that they worry when they don't have any transparency. And we have to be transparent around those kinds of things. But you also have to reinforce where decisions lie within the context of the work. So for us, we have come up with 3 decision makers. And I talk about this with every single person who works here at the village, and our leadership, our frontline staff, our physicians, our dentists, everyone. And we talk about the decision makers as being threefold. Number one, is it better for our patients and families? If it makes it better for our patients and families, then we should probably do it if it's reasonable. And if you can do it within your work, within your role, within the guardrails that we have set, then go ahead. And if you bump up against those guardrails, then talk to the next person in line or the coworker that you need to run it past. But go ahead if it's better for our patients and families and it's within your purview to do. You don't have to ask permission for that. The second thing is it better for our staff or our providers? And if it's better for our staff or our providers and it's better for our patients and families, we should write it into our annual goals or we should put it on our strategic plan, and we're going to do that. And then the third thing is it a safety issue? And before I came here, there was a lot of what I like to call death by committee. And that included some safety issues where people felt like they had to ask permission to do something or they had to run it past the safety committee before a decision would be made. And I said, if it's a safety issue, I expect you to take care of it. No questions. Take care of it. And later, if it's something that I would have decided differently or your leader would have decided differently, we'll have conversations about that. And those conversations will be about how I thought about it and how you thought about it, so that we can come into a common understanding of how we think about issues and how we make decisions, so that we can understand where we're coming from. But know that I have your back if it's a safety issue. And saying that really clearly to the staff and being able to empower people so that they can do their work and be with their teams to make those decisions has been really empowering for the staff, transformational for the work that we're doing, has eliminated safety issues right off the bat. And people actually get invigorated by this work. They come to my office on a regular basis to let me know about some of the decisions that they've made that they're so proud of. That's really exciting for me as a leader to be able to let people do this work because they're at the front line. They know where those pain points are.
That's wonderful. Really empowering the team to make the care delivery as good as it can be and really address some of those issues. So how do you, as a leader, really incorporate compassion into what has to be the business of healthcare? Because while obviously on the safety level, you really are empowering the team to make sure they're addressing those issues. Everything from, meeting targets on quality and safety to meeting targets related to the bottom line. How do you both encourage and remind the entire team to really bring compassion to that?
Yeah, I think, again, it's about transparency and being really honest with people. People know the doors need to stay open, and we are a business. We have to be able to pay the bills, keep the lights on in order to be able to provide health care. But the other side of that is that without the staff and without the physicians and the providers of care, we wouldn't be able to give health care. We wouldn't be able to provide it. And so there's a balance in that work. And if we talk about that with the staff around the ability to not only provide really high quality, safe health care that makes a difference in the lives of these children and families that we are here to serve, but also is able to make sure that we're here to serve them for tomorrow and well into the future, then they bring ideas to the table. And we talk about that really clearly. We listen to the stories of the staff, listen to the stories of the physicians. Where are those pain points? Have clarity around what are the guardrails for the decisions that they're able to make, and what are the impacts of those. Sharing business plans, being able to talk about financials in a way that doesn't make it the only decision maker for the business or for the entity, but really becomes a part of the story, because they all come together to be able to make us not only be able to provide healthcare today, but well into the future. And if we don't talk about those things together, then it becomes a struggle, I think, and a competition for, well, is this about health? Is this about compassion? Or is this about the bottom line? And really, they're all the same thing.
Couldn't agree more. It sounds like you've really gotten your team to use storytelling and compassion to lead better. So I'm going to wrap up with asking you what advice you'd have for those who'd like to bring this type of culture of compassion and empathy to their organization. What would you suggest they do?
Yeah, there's a couple of things that I would really suggest. And the first thing, I'll go back to that story about our staff member losing her husband and my conversation with the other leaders about how we don't have to have the perfect words. I would say you have to take small steps and lean into this. You have to be vulnerable as a leader. And when I say leader, that doesn't come by your title. It comes by just who you are within the healthcare system or within this space of being humans together. And really lean into it. Share your stories. Be vulnerable. You don't have to be perfect in this. Don't feel like you have to have the perfect story or the perfect words. Pull out those examples and speak from your heart. And if you tell your story, it encourages other people to tell their stories. The why in this work is really important. Why we do this work, why we show up every day in these hard places, and why we make the decisions that we make. And they are all influenced by the stories that we have and the places that we come from. And by sharing those, we can get better together, and we can be humans in this place of delivering and receiving healthcare.
Wonderful. Your work is really inspiring. Thank you so much, Laura, for continuing to share your story and all of the work, amazing work you've been doing to reduce stigma, particularly around mental illness and connecting people to treatment.
Thank you so much. It is important, and it's hard to be so vulnerable sometimes, but if we don't do it, who will? And we must in order to change the future.